Dr. Lonnie Harrison with the Arkansas Heart Hospital is here to tell us about the different ways stem cell therapy is being used. Good morning.
Good morning.
Thank you for being here.
Thank you for inviting us.
So stem cells, it's something that we've all kind of heard the word, but I don't think a lot of us really know what it is. Can you kind of explain?
Well, to put it in lay terms, I think stem cells are best explained by cells that are wannabe cells. These are cells in the body. They're everywhere. They're mostly in fat tissue, but they're, of course, in the bone marrow and other places. They're cells that want to be other tissues. They haven't decided yet in life what they want to be. And so by taking stem cells from one part of the body and helping or injecting those into other parts of the body, it can rejuvenate and build new tissue.
And pretty much grow into anything that's needed in the body,
For
right?
the most part, that's very true.
That's amazing. So you guys have a great stem cell program at the Heart Hospital. Can you talk a little bit about what you guys actually do at the hospital with it?
So we have several different programs at the Heart Hospital. One, of course, is cardiac. Those patients that have problems with their heart in that they don't get enough blood to their heart, they have had heart failure, or they have chest pain that is not revascularizable with either open heart surgery or with a stent. They may get injection of stem cells into the heart itself. The other program is for peripheral vascular disease, those that have critical limb ischemia, those that can't get enough blood to their legs and are losing blood supply. Maybe they have lesions that are not, or sores that are not healing, things like that. We actually inject stem cells.
Wow.
In patients with COPD, chronic obstructive lung disease, we also harvest stem cells from adipose tissue and help with the lungs. And of course, our orthopedic program for various shoulder problems, knee problems, and so on. So it's a pretty inclusive program.
Yeah, it sounds like it's kind of all over the map. So when talking about the orthopedics, though, the stem cells, are they injected into certain areas where people
They are. They're
help?
harvested from adipose tissue. They are put through a process of centrifugation and also of a treatment to isolate the stem cells and the matrix, and then they're injected into the knee itself, into the shoulder for repair of tissue.
Now, I know when stem cells first started, being talked about, came to the forefront, there was some controversy over stem cells. Has that kind of died down a little bit and subsided now that people are more familiar with it?
I think yes and no. I think you still have to be very careful about the stem cell center that you go to. There's still some centers set up that are really not qualified stem cell centers. But for the most part, people are getting used to the name, and so many people have benefited from stem cell. It's just amazing how many people have benefited. And I would encourage the folks too to maybe check our website and go to some of the interviews there with patients and what they've experienced with their stem cell therapy.
So you guys have videos on your website that explain some of that. Great resource to go to, and if you do need more information, you can call their phone number there at the Arkansas Heart Hospital. You can also visit their website. Sounds like it's a great place to go if you are thinking about or interested in any aspect of stem cells. Dr. Harrison, thank you so much for being here.
Thank you.
All right, well, up next we will check on